Hey,
How
what's
are
up?
you?
I'm good. How are you?
I'm alright.
Okay. All right. So, we talked about this before. We have this unique thing going that we've seen lots of people for. And last time, I wrote down that you were like wanting to do an amputation of your leg.
Mm-hmm. Yes.
What is that?
That's
That's
still what she wants.
That's what I want. That's what I wanted for like the last 10 years.
The gal she's doing PT with actually agrees with her. Says there's not much that can be done.
Yeah, we got the EMG, and there's some like decreased nerve signal, but it's not like horrible nerve.
On my legs, like this bump that I have here, anytime you touch it, it's like I feel like I'm getting shocked.
Okay.
Well, yeah.
And it's back from my brace.
There's no question that she's feeling pain.
Oh no, I'm not saying you're not having. I mean, you're obviously, it must be horrible, or nobody wants to, like nobody would consider an amputation for like a mild problem. And you said you've been asking for it for a long time.
Yeah.
Show me your range of motion again, isn't it?
That's as bent as it gets.
Okay. So it
And that's
moves
as straight as it gets.
barely.
And like my kneecap doesn't move.
Yeah.
It's stuck. It's.
Can I?
You can
Is it
try.
gonna
It's
kill you
gonna
if
hurt,
I?
but you can try.
Okay. So what level of amputation are you?
Above the knee.
Right. Okay. Does that be the only thing that would make sense
Yes.
to do?
I'm not trying to go crazy and be like way up all by the hip. No, I want to have some quality of life. Like, it's all right. I'll be 40 in February, and for the last 13 years, I feel like I'm trapped in my life, in my body. I have no control over it. This doesn't work, and so it's just like.
Can you pull up? You can, but it's weak. Okay. And what was the original thing that?
A 6 millimeter tear in my meniscus from a car accident.
So, and then you had a knee scope.
Yep, they went in and replaced that. They put I think they said an H-shaped implant in to hold my meniscus together.
Mm-hmm.
And then physical therapy, 6 weeks, no weight bearing, no walking. Then I started physical therapy, and within weeks I started losing range of motion.
Mm-hmm.
So they referred me back to my orthopedic, and they did manual manipulation under anesthesia. And they went in, did everything. I was on a CPM machine for 23 hours a day for 6 weeks. And then once I started physical therapy again, I started losing range of motion. And I've been like this for my last surgery was in 2012.
This?
Yeah.
That hurts for me to just barely touch like that.
Yeah, it's sitting in like a shock that's like going up and like down like this behind my knee.
Any of that over here?
Like I don't really feel it. Like I see you touching it, but like that's sensitive right there.
Right there.
Yeah, like that's real.
Oh man. I mean, your physical therapist, what did they?
They think the same thing.
Yeah.
She honestly, she's like, I'd probably honestly bet you would be in less pain if they did it. And I was like.
So the risks with amputation. I mean, obviously, once it's off, there's no going back, right? So you would have to use a prosthetic eventually. After a couple months, you got to let everything heal, and then one thing to really work on would be glute strengthening.
Yep.
Have you been doing that?
Yeah.
So like laying on your stomach and trying to like.
Yeah, they had me trying to do that, but with the. I don't have the strength to do it. I can do it with this leg, no problem. You know, do leg raises or lay on my side, fine. But this one, it's like they have me do leg raises.
I'm talking about
like that. It's like going like, yeah, they don't have me do anything like that yet. But if Corey wants to, she's like, I need it to be cleared or whatever. So she's like, but your knee doesn't move. And I think that's when she decided that she agreed with the amputation, just because kneecap doesn't move. What other thing did she say?
Where are you going to physical therapy?
At Council Oak Creek Nation. Let's see. That would be my dad. Yeah, that's my dad.
Yeah, that's who I'm looking for.
This is my dad, Daryl. Daryl, this is Dr. Burrows. This is my dad, Daryl.
Nice to meet you.
Just wanted to know, like, what our next step was. How much longer I'm no weight bearing. That I've been in PT for 3 months. That's everything. Oh, can you explain to my dad why I'm not a good candidate for a total knee replacement?
Yes. So if the decreased range of motion is unlikely with the scar tissue, and it happened after a knee scope, which is a lot less of a procedure than a total knee replacement. So we wouldn't expect her to get full range of motion after a knee replacement. And her knee arthritis doesn't look, you do knee replacement for knee arthritis, right?
Yeah.
Let me pull this up here. So, she has good joint space there.
Mhm.
I mean, that's with the knee trying to be bent, so it's not a perfect looking x-ray.
Right.
And then here, she doesn't have lots of bone spurs. It does look like she has decreased bone mineral density, meaning like just because you haven't been using it for 13 years, your bones aren't getting the exercise and stuff they need to be strong bones. The hip, they got hip x-rays, that looks okay.
Do I have a tear in my hip? Because I saw a chiropractor, what day was that, Monday, Tuesday? Wednesday. And he said from images that he saw, it looked like I had a tear in my hip. And I figured while I'm here, might as well ask, because if I do,
I mean, because she's
I'll
had
be
other
back
doctors
next
tell
week.
her the same thing, that she's had a tear
But then they're like, oh no, you
in her
don't.
hip.
Does your hip hurt?
All the time.
All the time. I've been told, in 13 years I've been told I have a tear, I don't have a tear, my hip is slightly fractured and dislocated. I've been told it's not slightly fractured or dislocated. I've been told all kinds of crazy things. This and this, 13
Yeah,
years.
she's
Your hip
gotten,
is dislocated?
she's gotten
Well,
slim.
I'll show you.
It's not dislocated.
I'm gonna stand up the best that I can. Right here, you can tell that it's something, it's not a bump here and there's a bump here.
Yeah.
And then my left hip is slightly higher than my right. But it could be because of the way that I stand, because of my leg or
Yeah,
whatever.
I mean, just
But-
looking, you can tell that this leg is a lot. Yeah, you probably have a tear here, what's called the labrum, or this ring of cartilage around the hip joint itself. It is arthroscopy. Let me look at the report and see if there's anything else that
I would just ask you, because I've been told so many different things.
So, from an injury from the wreck or whatever, you could have had a hip dislocation then, I don't know. But I would assume you would know if you had a hip dislocation.
Well, I complained about my hip the whole time, and they just said it was because of my knee. So nobody's actually looked at my hip besides images like that.
Well,
If
yeah.
you never had to have it popped back into place, like physically by
They may have tried that because everyone's been too focused on my knee though. That's
Well,
what everybody focused on.
When your hip goes out, because mine has gone out multiple times because of Ehlers-Danlos.
Something together.
You wouldn't be able to
Not
stand.
having it popped out.
Yeah,
I mean,
it
you
would
wouldn't
be
be
like,
able to.
it is not dislocated now, and if you did have a dislocation, you would know, and you would have to go to the emergency room to get it popped back in.
Yeah,
it
you
doesn't
would
just go back
remember.
in.
Because when I told them, I was like, I complained about my knee and my hip, and it was like everybody just focused on my knee and not my hip. And I'm like, I still have problems with my hip. pain over my hip.
Yeah, having your hip put, go back into place is not something
Yeah, I don't,
unless you weren't awake for it.
yeah, no, I don't think so. You found me. I just saw that you had texted me,
Oh.
and I said you found me. It's past the urgent care. If we had known that the urgent care was there, she said she would have brought me here originally instead of going to Claremore.
Okay, I don't have the MRI report, but I would say let me take a picture here. Does it? Does that cause hip pain, knee pain?
Pain like right in here.
How about this?
Oh, right here, man. Right here. Right here.
Is that hurting your knee?
Mm-hmm.
All right. I mean, I think amputation is like an extreme thing. Although I understand what what you've been going through and things, and I get it. I mean, it's basically like your leg is just in the way all the time.
It is.
Yeah.
How many times have I tripped you with my leg, or tripped my dad with my leg, or...
So, I know you've been thinking about it, but it's, I don't think a total knee replacement would help you. Is it more the range of motion or the knee pain?
It's like all of it.
Yeah.
It's just all of this.
Yeah.
Well, see, that's like at her physical therapy, all her therapists that she sees, every one of them says that there is so much that they can do, but they can't do because they don't know what your plan of action is.
Well, once Corey realized that my kneecap doesn't move, that's when she said that she agreed more with the amputation. And so did Sarah.
You can do, you have no restrictions from me.
Okay.
You can, if they want to try to work on bending, that's fine. If they want to try to work on strengthening, that's fine. I don't think it will be too effective, to be honest with you. But it is, it's a very unique situation. I don't regularly see stuff like this. I mean, I don't think anybody does, to be honest with you.
Your knee is my liver.
Yeah, high five. That's all we're besties.
So, it's something to consider, but I don't know of anything else that would fix it that you haven't already done,
So you're basically saying that there is absolutely nothing else that can be tried before.
I have my mind set up on what I want because I've been through this. My dad wants me to go through every single avenue possible.
I want everything exhausted.
Yeah.
And I've done everything I've been told to do.
Yeah. I mean, I don't think a total knee would do anything for you. There's physical therapy, there's, there's things like stem cell things, and all these things that I don't think would help. But if we're trying to exhaust every option, then trying stuff like that.
That's where I'm at. I want to make sure.
You're not trapped in my body.
I understand that, but the amputation is, I'm just saying, the amputation being the very last thing.
Trust me, I don't want to do it on a young, healthy girl.
I mean, and I understand where the sound's coming
Oh,
from.
yeah.
I mean, she, you know, I've ever since she's been moved up here with me, I've watched her go through,
Yeah.
you know, all the pain, and I've seen her, and I understand, you know, what she's saying, you know, but I just want to make sure that,
Why don't I,
you know,
there's a guy in our clinic, he does most of the amputations for our group.
Okay.
Why don't you see him, get his opinion, just to another, I mean, I don't know how many people you've seen.
Yeah,
A lot.
that's my 9th or 10th
Yeah.
orthopedic I've seen at this
Right.
point. If not more.
So, I mean, nothing that they haven't already recommended or tried, but why don't you see Dr. Marsh, and he can kind of talk to you about that. If you decide to do it, I'm happy to help him with it or something, but I mean, I don't have another great option, but maybe Dr. Marsh does. He does everything from shoulder to like toe things. He does all kinds of stuff. So he may have you know, a tendon transfer thing or something that he would recommend.
I mean, that's all I'm asking.
I get it. You know, like I said, there's no going back. You know, once it's done.
Once it's done, it's
yeah,
done.
yeah. You can't.
Nothing's changed
glue
in
back on
13
a
years,
leg,
so
so.
I don't think cutting it off is going to make any differences. Hasn't changed in
I
13
mean,
years.
so one thing with amputation, you do get like what's called phantom pain. So you still feel like your leg is there sometimes, and people will be like, I feel like I'm, you know, my toe is crossed, but I look down and I don't have a toe. So it's just, that's why it's called phantom, because it's not there, but your brain still has the nerve connections. They're just cut off, so your brain still feels like you have a foot.
Now, is
but you
it
don't.
is it super common in everybody to have phantom pain, or is it just kind of?
I would say more often than not, people have at least.
Your grandfather had it.
Yeah. I would say more often than not, people have, and it may not be pain. It's just a phantom sensation, maybe that, you know. I had one patient that felt like their knee was bent all the time, and